Hi, welcome to the Fit and Healthy Today show. Today our discussion will be on high cholesterol. I'm your host, Heike Turchiano. This is a fairly somewhat controversial subject, as there are different theories on whether cholesterol in and of itself causes cardiovascular or heart disease. And I'm going to present some data and information to you that hopefully will allow you to make a more informed decision. First of all, I want you to have an idea about what cholesterol is. It's a waxy type of substance that every cell in the body requires in order to function. Your nerve cells, your brain cells, as well as your sexual hormone production. Very, very important for that as well. Doctors tend to focus on two lipoproteins regarding this. The low-density lipoproteins, which are listed as your LDL, and HDL, which is your high-density lipid proteins. Your LDL are carriers for cholesterol in the bloodstream, and your HDL is kind of like the good old housewife that comes back afterwards and cleans up that LDL. When we're talking about what tends to cause high cholesterol, there's a lot of different factors that affect that. Genetics and heredity, how your liver produces or metabolizes or utilizes or gets rid of cholesterol. A surprising fact that most people don't realize is that 75 to 85% of cholesterol is produced in the liver. So diet has, or additional amounts of dietary cholesterol have very little effect on the actual overall cholesterol production by the liver. We'll talk about other things that do affect that production of cholesterol. Foods high in saturated fat and trans fats are a contributing factor to liver inflammation and the liver becoming sluggish so that it finds the need to increase cholesterol production. Lack of exercise and circulation, smoking, and probably one of the key factors regarding cholesterol is diabetes or high blood sugars. The reason being is these high blood sugars cause the blood to become very, very sticky. The red blood cells, then you get an increase in the LDL. There's a French study that showed, however, that these blood sugars, or the spike in insulin versus the actual cholesterol increase, is what actually was the best measurement for cardiovascular disease. Our physicians or our medical establishment tend to focus on the LDL, HDL, and something called VLDL as being indicators for risk factors for cardiovascular disease. But it appears as though there's some studies that support more that insulin and blood sugars might be a better indicator in that regard. Risk factors regarding high cholesterol and what is called cholesterol oxidation. What happens is cholesterol can become oxidized, and there's some contributing factors that we'll talk about later on that cause cholesterol to build up in the vascular system, thereby making the arteries narrow with time. When we're talking about LDL and HDL, LDL will go in and repair or tend to smooth out these vascular imperfections, and then HDL comes along and cleans it up. When you get the testings for cholesterol, you'll usually see a ratio measurement at the bottom of your test that tells you whether you're low risk or medium risk or high risk. And generally, as a rule, if your ratios of LDL to HDL are 4 to 1, then you tend to be average or lower risk. So if it's 4 to 1 or less. So for example, if you have an LDL of 160 and an HDL of 50, your ratios are very good, whereas your overall cholesterol might be 210. The medical establishment has set a 200 as being a setting for total overall cholesterol. And that has changed through the years, going from 240 to 220 to 200. And now some physicians are recommending cholesterol even be dropped further. The National Health Institute A very important study that they did in a culmination of data found that there was no direct link between cholesterol levels and heart attack or stroke. So, this gets you thinking, okay, you know, if there's no direct link, why are we so worried about lowering the cholesterol? Okay, indirectly cholesterol affects it, but there's other major contributing factors that seem to be more contributing causes to arteriosclerosis or heart disease. Another thing that tends to raise cholesterol oxidation or cholesterol is the lack of antioxidants, hydrogenated fats like margarine, cancer-causing chemicals, pesticides, synthetic sweeteners, anything that's chemical-based that cause what's called an oxidation, which is kind of a rusting of the vascular system, will cause a rise in cholesterol or cause cholesterol oxidation. Okay. Something that physicians oftentimes don't focus on that I have a grave concern about is I hear this, let's get your LDL below 100, you know, you're at lower risk. The concern is there is something called hypocholesteremia, and what that literally means is when the cholesterol drops below 140, then you have what is called low cholesterol. And low cholesterol can contribute to manic depression, mood issues, the inability of the vascular system to repair itself, the cells not being able to repair, inability to heal. There's so many different factors associated with lowering cholesterol too low. So keeping in mind that we want cholesterol to be down, but not too low. There was a Japanese study that basically found that when cholesterol ranged between about 180 and 220, with maintaining that within 4-to-1 ratio of LDL to HDL, the cardiovascular risk dropped significantly. Okay? I'd like to move on to explaining, and this is a very important part of something that's necessary to help either lower cholesterol or reduce inflammation in the vascular system to keep that cholesterol from building up. Good fats versus bad fats. I hear physicians quite often say, okay, I want you to keep your fat as low as you possibly can, and I kind of gasp because I recognize that there's differences between fats. And I think it's kind of important to give you a little background so you're aware of what the good fats are versus the bad fats. Plant-based omega-6 fats such as borage oil, walnuts, almonds, pecans, hemp, flax actually reduce inflammation in the vascular system and cause, obviously when you reduce the inflammation down, it can prevent those blockages and clots. So remembering now, for some reason everybody's kind of lumped omega-6s together. There are plant-based omega-6s that are very, very helpful at lowering cholesterol and reducing inflammation. Okay. Now, the omega-6s that we refer to as kind of being the bad fats, you have to have some of them because saturated fats are necessary for cellular repair and cellular function. The omega-6, what we call bad fat, where we don't want to have excessive amounts of them because they contribute to arterial inflammation and that oxidation word we used before, which oxidation is the kind of the rusting of the vascular system, would be from meat, dairy, trans fats, which are like your margarines, those types of things you want to avoid. Also, some physicians, and there's some good studies that are coming out on this regarding omega-3 oils, and there are plant-based ones and there are also fish oil-based omega-3s. Omega-3 nuts have them, flax has them, fish has them, and basically what they're finding these omega-3 oils are doing is they're helping to lower the cholesterol, reduce inflammation, which includes reducing inflammation in the liver itself. And when you reduce inflammation in the liver, it's a little happy camper and it moves along a lot better and the cholesterol comes down. Reducing blood stickiness and inflammation, so you're not going to get that coagulation of the blood causing or contributing to cardiovascular disease or to strokes. So, when we discuss diet as a contributing factor to either help or contribute to cholesterol levels, what I found in the research out there that has clinical data backing the following things we find to be very, very helpful and mindful of. High fiber, water-soluble fibers. So you're not talking about your wheat bran. We're talking about water-soluble fibers. And water-soluble fibers would include fibers from fruits, veggies, whole grains. They found overall that they reduced what's called blood serum cholesterol levels. That means the cholesterol that's roaming around in the vascular system. And it also helps attach these and take them into the bowel and remove them as well. Veggie juices, such as carrots, celery, beet juice, help increase bile secretion, which cleans the liver, gets the liver moving, so that the liver isn't so sluggish and responds better. You obviously have to be careful with carrot and beet juice if you're diabetic, because it will affect blood sugars. Using unrefined oils, that means oils that aren't heat treated. They're cold press types of oils, in which literally they have cold presses that press the oil out of the plants, including flax, olive, hemp, grapeseed. As discussed earlier, these are omega-3 types of oils that can help lower the cholesterol and reduce the inflammation in the vascular system. Now, when we're talking about the types of dietary things necessary to reduce cholesterol or reduce vascular inflammation, and that's really what this is all about. I think the focus really needs to be by our medical establishment or all healthcare professionals is how we can reduce the vascular inflammation so the cholesterol doesn't stick. When the vascular system gets jagged, the body sends a message to the liver that we need to produce cholesterol to smooth those arteries out so we can keep the blood supply going. When we reduce the vascular inflammation down, then we don't have those jagged edges forming in the vascular system. So the things that contribute, that cause cholesterol to stick on the vascular system or cause sticky blood, so where the cholesterol can gather and collect, or oxidize, rust, avoiding all hydrogenated oils. Like I said, shortening, margarines. You're going to look for those hydrogenated oils when you're looking for ingredients on your food products. Cereals, crackers, oh, notorious for that. Bread products using hydrogenated oils. Protein shakes, there are certain protein shakes out on the market that add hydrogenated oils to make you feel full, but they're very bad for you. I mean, they cause your vascular system to just get inflamed and oxidize the cholesterol. So, and then avoiding alcohol and refined sugar or flour. As mentioned earlier, there was a study done regarding insulin spikes. When the blood sugar rises, the body increases insulin production in order to get the blood sugars to absorb and be utilized. Well, when we have alcohol, which is pure sugar, and we have sugar or refined types of carbohydrates, it spikes the blood sugars, and when you spike those blood sugars, then they in turn cause vascular inflammation as well. So things you want to avoid, being aware. Okay. Exercise, and anytime before you start an exercise program, you need to recognize that you need to consult with a healthcare professional before you start an exercise program. But regular exercise appears to be able to normalize LDL as well as help raise the HDL level and increase circulation, the blood moving. Okay? You must be aware that there are certain drugs that can raise cholesterol. Very mindful. Steroids, oral contraceptives, diuretics, beta blockers, which are used for hypertensive, high blood pressure, and then certain types of drugs used for Parkinson's. So you need to check with your doctor or your pharmacist if you're seeing elevated cholesterol that you need to address, that maybe the drugs may be a